I am Jill Taylor, the Emergency Coordinator here at Edgar County ESDA. I would like to take some time to answer some questions you may have in ESDA's role in this COVID-19 pandemic. ESDA stands for Emergency Services and Disaster Agency. We are the lead role in all of the emergency planning for the county. We also operate the Emergency Operations Center, also known as the EOC, which is located here at our office. We also work closely with the first responders and provide them resources as needed in the event of an emergency. Our main responsibility is to provide and collect resources for Horizon Health, our local nursing homes, and the first responders in our county. We have also received several supplies from the state of Illinois of PPE, which stands for Personal Protective Equipment. We have also had several individuals and businesses donate to our county.
Our agency is responsible for administering Edgar County's public health emergency response for the COVID-19 pandemic. The Health Department works with Edgar County Emergency Services and Disaster Agency as the county's lead emergency response team. Our emergency operations procedures and response plans have been activated and are strictly followed. Our staff is trained and well prepared for the public health emergencies, and we continue to work with the community partners to minimize the spread of the virus.
So we have a pandemic plan in place. We have implemented a COVID unit, which is actually segregated from the rest of the hospital. It is an 8-patient bay area that we can put a COVID pending or a COVID positive patient in. It has a separate ventilation system. We have implemented a donning and doffing area. We have a neutral zone, and people are being adequately trained and educated to care for patients in that area. One of the biggest downfalls about this disease, we have had to institute visitor restrictions throughout the facility in an effort to minimize cross-contamination. So we are not allowing anyone to be in to visit.
The communicable disease nurse will confirm the diagnosis with the lab and then contact the primary care physician or provider to confirm that appropriate steps are being followed, such as self-quarantine, to prevent the transmission of the virus. Once onset date is confirmed and all potential exposures are identified, all the patient's contacts with persons within the contagious period are notified. Close contacts are then advised to self-quarantine and monitor symptoms for 14 days.
So absolutely. We will evaluate you though. We will talk through some questions. We will go through a history and physical. We will see you in our respiratory care center if you're ambulatory, and we will go through appropriate questions based on CDC, IDPH, and the IHA to determine if you are requiring testing. We do have the capacity to do some extensive testing. The other thing is, if you don't meet those requirements or you're not demonstrating signs and symptoms, the guidance is to stay at home and shelter in place.
Anyone with symptoms or with close contact to a suspected COVID-19 case is advised to self-quarantine, maintain social distancing of 6 feet from other household members, and avoid sharing of household items.
We want to care for our community and for our patients. We have every plan in place to try to segregate the patients that have COVID signs and symptoms, and we want to continue to provide the health care that we have been committed to over the course of time. So we still have the ability to take care of you, to keep you specifically safe from COVID, and get you the needs and the resources. So what we are doing with our PPE levels is we are being very conservative. We're being good consumers of our PPE. We are not throwing things away that don't necessarily need to be thrown away. We are asking staff to reutilize masks. We did reach out to our community resource through ESDA and through different resources from the government to ensure that we had adequate PPE should a surge happen here at Horizon Health. So we feel that we are very well protected, and we do have the adequate PPE for our staff and for any patients coming in. We are constantly reordering supplies and getting supplies that have been on back order through our facility, and we are keeping a constant count on how much PPE we have.
The Edgar County Public Health Department has submitted PPE supply requests through a reporting system with the Illinois Department of Public Health. The health department has received multiple supply drops through federal and state resources. Those items have been donated to the Fire Training Center, which is where the county's Emergency Operations Center is located at this time. Items include face shields, N95 masks, surgical gowns, and procedure masks.
Yes, we are still seeking donations. If you're an individual or a business in Edgar County and you would like to donate, please contact the Edgar County ESDA office at 217-466-3180.
The stay-at-home order issued by Governor Pritzker on March 20th, 2020 states that all businesses and operations, except essential businesses and operations as defined in the order, are required to close and cease all activities. Essential businesses are those such as stores that sell groceries and medicine, food and beverage, and agriculture production, gas stations, post offices, restaurants for consumption off premises only, transportation, laundry services, and financial institutions such as banks. Non-essential businesses are those such as public places of amusement, zoos, fairs, playgrounds, bowling alleys, theme parks, and movie theaters, fitness and exercise gyms, spas, salons, barbershops, tattoo parlors, retail stores, and many others. For a full list, please consult the governor's orders. If you have questions or concerns about a business in Edgar County, please call the health department. The governor addressed this question recently as he stated that things are changing so quickly, the rules have to be adjusted often. However, he went on to say that employees should stay home when they're sick, and employers should not penalize their employees for staying home. Businesses should not force employees to report to work when they are sick. Good practices for monitoring employees' health include checking and logging temperatures upon arrival to work, and checking for any symptoms that would be cause for concern. The health department has tools to help employers monitor their employees. Best practices for long-term care facilities include strict adherence to social distancing through a no visitors policy, canceling group activities, monitoring resident vital signs and symptoms twice a day, and monitoring all staff for fever or symptoms daily. If a facility is notified of a positive COVID-19 result, no further testing is advised. Instead, other patients with symptoms should follow the same steps to isolate and quarantine as a patient who is positive.
So in a pandemic plan, what we want to do is we want to try to keep the patients as local as possible. That means keeping EMS resources available. That means keeping the patient at a level of care where they are appropriate. Obviously, if we recognize that once they stop at the local facility that they need extensive care or something that we cannot offer them, then we will attempt a transfer process. At this current time, we have the capacity to transfer to all of our regular hospitals that we typically transfer to, such as in the Terre Haute Market, Sarah Bush, Carl. But in the event that the pandemic would hit this area, there could potentially be a situation where all patients would have to stay at our facility.
According to the CDC, coronaviruses are generally known to be spread from person to person through respiratory droplets. Currently, there is no evidence to support transmission of COVID-19 associated with food.
Yes, before all the business closures and the stay-at-home orders, Edgar County, along with key personnel from the county, have been working to put a plan in place. It is called our Alternative Housing Plan, and it was approved by the state of Illinois in early March. It uses a local motel here in Edgar County to house COVID-infected individuals or those who may have possibly been exposed to COVID-19 and need to self-quarantine for 14 days, and they have no other residents to do so away from family members. Edgar County ESDA, Horizon Health, and Edgar County Public Health Department have teamed up to send residents of Edgar County COVID-19 information via text message. If you would like to sign up, you can contact the ESDA office at 217-466-3180 or visit www.edgarcountyillinois.com and click on the emergency alert link.